And then I think, oh, and then Eric, there is, should I attend appointments with my healthcare professional? And then secondarily, are the infusion clinics there to keep us safe? Maybe if you wanted to focus particularly on the healthcare professional question, because we had the webinar around telehealth a few weeks back.
Yeah, so I mean, I'll deal with both questions. I think they're both excellent questions. So I mean, I think most healthcare providers still, to this day, are really trying to do the visits virtually if they can. So that could be by telephone or it could be by video conference. So certainly, if your appointment is shifted to a virtual means of seeing you, then please take that appointment. If you're worried that you're sick and your message is not getting across by telephone, then make sure you say something to your doctor or to your nurse, and they will see you. For the most part, they'll try to see you in clinic if they need to. Be aware that obviously seeing you virtually is not the same thing as feeling your belly and having a look at you and doing blood work and doing all those things. But if you go back to one of the previous webinar from 2 weeks ago, I think it was, Dr. Nguyen and Dr. Wang really went into good depth about how we can see patients virtually and do a good job and still monitor for inflammation and things like that. If your doctor is telling you to come into clinic, maybe there's a reason. You can ask why, like, why do I need to be there in person? I think it's, we're doing our best to keep patients safe. Certainly there are fewer patients than there have ever been in the hospitals and the clinics. And so I think as long as you're physically distanced from other people, as long as you wash your hands really well, wear a mask, you'll be okay if you have to go in to see your doctor or need blood work or any tests or anything like that. As far as the infusion clinics go, I'm going to share my screen again. I want to try to emphasize that a lot of this is on the website. If you go here on the right-hand side, there's this navigation bar, and you can go to the FAQs, the frequently asked questions, and there is information there about what infusion clinics are doing to try to keep you safe when you go. I'll have to try to find it here if I can, but it's here somewhere. Essentially, they are doing an excellent job at really trying to keep, this is not the COVID-19 infusion FAQ. So I apologize. It's here somewhere. There we go, get answers, I think maybe. Gil, help me out. Live demo never works properly. There we go. This is it. So lots of frequently asked questions, and here it is. Is it safe to visit my infusion clinic? And there's information there, but essentially the infusion clinics are doing a very good job at making sure that you're physically distancing, making sure that the nurses are using protective equipment so that they're not infecting you and you're not infecting them. And that does mean that they can probably see fewer patients frequency per hour, and so that means that your appointment might be shifted at a time that might be not as convenient for you. So please be patient with any appointment shifts, but they're making those changes because they want to keep as few people as possible in the clinic and make sure everybody is 6 feet apart and so on. So in general, I think that yes, it is safe to visit the infusion clinics. It's safer to continue your biologic than to skip or miss doses. So please do that. You can speak to your doctor about doing a rapid infusion. So in sort of just over an hour instead of just over 2 hours, that will kind of get you out quicker and make you safer. If you're getting the injectable form of a biologic and you're going to the infusion clinic to do that, speak to your biologic patient services programs. A lot of them are now offering training virtually by video conference to show you how to inject yourself at home if you feel comfortable doing that. I think that's worthwhile to keep you out of the infusion clinic and keep you at home as much as possible.
Yeah, and the other thing I would add is that addressing the infusion clinic was one of the first things that we did as a COVID task force. In fact, our second webinar on March 26, we invited the executive heads of the 4 major infusion networks in the country, Innomar, Inviva, Cloverdale, and Bayshore, to come in to talk to the IBD community, to express all the things that they were doing to make those infusion centers safe for them. And so that's actually, that's conversations that is on the website that Eric showed. And just to give you a bit of the backstory to that, at the time, the infusion centers were not deemed an essential service. And what that means then in a lockdown scenario, if you're not an essential service, you have to shut down. And in that setting, nurses couldn't work in those clinics, patients couldn't go to there. And so that was a huge crisis point that we identified in the task force and worked with CCC. And that's what we brought in to ask these questions. And we realized that many of the provinces had not deemed it. The CCC then advocated with the different health authorities in each of the different provinces, working with the infusion clinics. And within a week, every province had deemed the infusion clinics an essential service, which meant that if the lockdown were to then come, and remember, this was before we had all of the school closures and everything happening, that those infusion centers would not close down and the nurses working at them would not be redeployed into hospitals and so on. So that was a huge effort of the task force right at the beginning. But then it didn't end there. Then the next question was, if those who are getting infusions probably recognize that, back in 2019, those chairs were not 2 meters apart. And so then we had to figure out what are the ways to screen people to make sure that we're not allowing people who are potentially sick with COVID to go into infusion centers. We need to make sure that those chairs were spaced properly. We need to make sure that the nurses who were caring for those patients had the proper PPE and they had enough supply. And again, this was right on the radar for each of the infusion networks. The key was integrated work between the 4 of them, supported by our task force to give kind of medical direction. And we were able to address virtually every single issue that came up in relationship to the infusion centers. And I think that's actually one of our early wins from the task force.